Okay, the February 28th, 2017 meeting of the Human Services Committee will now come to order. Will the clerk please call the roll?
Mrs. Brown. Here. Dr. Carbone. Here. Mrs. Conley. Here. Mrs. Draw. Here. Ms. Harris. Here. Mr. Hebert. Here. Ms. Cayley. Here. Mr. Lightfoot. Here. Chairwoman Taylor.
Here. Is there anyone signed up for the public forum?
There is not.
Is there anyone present who is not signed up to speak, who would like to address the committee at this time? Okay. The next item on the agenda is the approval of minutes. You have the January 24th, 2017 minutes before you. They will stand approved unless the clerk is notified of any changes by the end of the day. The next item on the agenda is new business. Madam Clerk.
Referral 17-0074, amend Resolution 309.
Moved by Legislator Brown, seconded by Legislator Conley. Is there any discussion? Mrs. Brown?
Through the chair, do you have any data that you can share on the history of this program in terms of the cases treated?
I'm sorry, could you repeat the question through the chair?
Yep. Do you have any data that you can share on the history of this program and the terms of the cases treated?
And I'm sorry, the terms of?
The cases. The cases that were treated?
Through the chair, yes. We have received this grant for over a decade, and I can give you the exact number of cases treated, contacts identified. How far back would be helpful?
I would say just for the past, yeah, through the chair, a year.
Okay. I will submit that through the chair.
Thank you.
Legislator Cayley?
Thank you, Madam Chairman. Through you to the administration. In the years that this intervention program has been going, have we seen a decrease, a stagnation, or an increase in the number of STD cases reported?
Through the chair, each disease process has followed its own trends, consistent with the trends throughout the state and the U.S. Presently, we're seeing an increase in number of syphilis cases, an increase in gonorrhea cases, a significant decrease in chlamydia cases.
All right, thank you. I'm not going to ask you to make a conjecture as to why. I'll just go with that.
Thank you. I appreciate that.
I'm stymied. Through the chair to the administration, or back and forward, has the program itself changed much in its implementation?
Through the chair, throughout the course of the last 3 to 5 years, we have intensified our efforts to identify and bring to care all contacts of the high-risk groups that we are intervening in.
Thank you. And do you feel that that's becoming successful?
Through the chair, sometimes increased number of cases appears because you're doing a better job at finding them.
Of finding it, yes.
The data would certainly indicate that we are doing a better job at finding them.
All right, thank you.
Any other discussion? Being none, all those in favor, please signify by saying aye. Aye. Any opposed? Item carries. Madam Clerk?
Referral 17-0075, acceptance of a grant.
Moved by Legislator Conley, seconded by Legislator Draw. Is there any discussion? Legislator Lightfoot.
So, thank you, Madam Chair. Through you, Madam Chair, to the administration, this request to accept this grant in the amount of, well, just, and let me make it short to you, Madam Chair. To the administration, this grant is reduced by $570.
Increased.
Oh, it's increased. Oh, thank you so much. That kind of changes my question a little bit. And
Is that a never mind moment? Or what?
that could be one of those kind of moments. And thank you.
Any other questions? Legislator Kay.
Thank you. I'll give Legislator Lightfoot a moment to think. Through the chair to the administration, I noticed in here the funding varies annually and is dependent on the forensic laboratory is New York State eligible to receive the funds. Could you explain the eligibility? Am I the right one? Yeah. Anybody? We're on 75, right? Excuse me, through the chair?
Yes.
Okay. On the bottom of the main paragraph, it says New York State eligible to receive forensic laboratories. I would like an explanation, thank you.
Is there anybody here for the administration?
If not, Madam Chair, I can take it in writing later. You could take a stab at it. No?
Someone will provide a response.
All right,
in
thank
writing.
you.
Thank you.
That's all.
Legislator Lightfoot.
Bailing them out today. Thank you so much. So this increase to the grant, was this increase predicted? I know over budget season we talked about, the budget's compiled of grants and, unreceived grants and so forth and so on. But was this grant that we are asked to approve today, was this increase of $2,570, was this predicted that we will receive an increase in the grant or not?
Madam Chair, the increase was not predicted.
Okay, thank you so much. So, does this increase make a change to a budget line item within the fund of the department, or does this increase go to the Citizen and General Fund through you, Madam Chair, to the administration?
Madam Chair, one of the specific legislative actions, in particular number 2, seeks to amend the 2017 operating budget. So these additional funds will actually increase the appropriation authorization within the ME's office.
Okay, great. Thank you so much. I have no further questions.
Any other discussion? Okay. Being none, all those in favor, please signify by saying aye. Aye. Any opposed? Okay, item carries. Madam Clerk?
Referral 17-0076, amend.
Moved by Legislator Draw, seconded by Legislator Hebert. Is there any discussion? Legislator Harris?
Thank you, Madam Chair. Through the chair to the administration. I see that this has a particular match that's required by the county, and I'd like to know what the local match would be and how would the match occur via in-kind support.
Through the chair, Rodney Corey, Office of Mental Health. Yes, there is a local match. That match was accounted for when the grant was originally received in 2012, approximately $35,000. And there is no additional money needed for that match to extend it for a year.
Thank you. Can I have a follow-up question to the chair to the administration? Could you explain what the in-kind support would be, if there is some, or could you clarify what that is?
That's the Monroe County staff effort involved in managing the grant.
Thank you.
Legislator Kaley?
Thank you, Madam Chair. Through you to the administration, could you give me an idea of who the grant partners were?
Yes, through the chair. This has been it's been a large collaborative project between our office, the Office of Mental Health locally, as well as the Conference of Local Mental Hygiene Directors for New York State, Families Together of New York State, Youth Power, SUNY Buffalo, and other New York State counties.
All right, thank you. And who, through the chair, who takes responsibility for the collating of everything that happens with this in terms of recording the implementation of the core values? In other words, is this per county or county area? Is Monroe County, I feel like I'm on What's My Line? I'm not doing very well right now. Through the chair, is this a region that Monroe County might be responsible for? Is that how it works, or help me?
Through the chair, Monroe County is the lead on the grant. We manage the process through coordinated care services, and Monroe County is ultimately responsible for the performance of the grant. And we work with a number of collaborators across the state, including an evaluation team out of Albany that collects statewide data from each county. Each county's initiatives differ from each other, so there's difficulty sometimes in an apples-to-apples comparison from county to county because it is such a large upstate region. But otherwise, yes, there's a large evaluation component, and that data is currently being put together, and it's anticipated that would be finished by the time the grant finishes in September.
All right, thank you.
Legislator Hebert?
Yes, through the chair, what's the reason for extending the program 12 months?
This is a no-cost extension. This is funding that remains from the last year of the budget. So this last year of the program is intended to just finish up various projects around the state and give local counties an opportunity to finish up some of the initiatives that they've been working on too.
Thank you.
Any other discussion? Being none, all those in favor signify by saying aye. Any opposed? Item carries. Madam Clerk?
Referral 17-0077, acceptance of a grant from New York State Office of Children and Family Services.
Moved by Legislator Hebert, seconded by Legislator Carbone. Is there any discussion? Legislator Connolly.
Thank you, Madam Chair. Through the chair to the administration, I've been hearing through different budget discussions that it looks like the state may be cutting funding for this program in the future. Where does the program stand as of right now?
Good evening. Through the chair to the legislator, we are receiving, as you can see, if this honorable body decides to accept the $92,000 for the 5th year of this program tonight and on the full legislature, we anticipate not receiving anything in 2018, to be quite honest. OCFS has made it quite clear that they are decreasing funding last year, and I believe I mentioned it at the last legislative committee cycle, that they are siphoning down our dollars as well as the other 4 pilot programs that controlled Safe Harbor in New York State since 2012. They've commended us on doing such a great job, touted Monroe County and our partner Center for Youth, which is doing fantastic work. They've commended us, touted us throughout the state, but have told us that they are going to be taking our dollars, along with the other pilot-funded programs, and bringing them to other counties in New York State to start this Safe Harbor program in those counties. So we are commended for our great work, but not really rewarded financially. Through the chair.
Thank you. Through the chair, a follow-up. Is there hard data available about how many children have been contacted and served by the Safe Harbor program?
Yes, I can get you a full roster of numbers, but just prepping that before I came here tonight, we have had 266 referred to our program in 2016 alone. It's an astonishing number, seeing as in 2011 there were only 31 confirmed cases throughout New York State of sex trafficking for youth. So you can see that the advocacy portion of this project throughout the counties in New York State have really had an impact, and especially here in Monroe County. It's not because we have more here in Monroe County than anyplace else. It's just that we did such a great job finding the victims and bringing them the services they need. So in 2016 alone, we had 266 referred cases to the Monroe County Safe Harbor Program. And as of right now, 6 have been confirmed to actually be trafficked youth. Through the chair.
Thank you. Madam Chair, I just would like to tell the chambers that I'm very supportive of this funding. I think that the Safe Harbor program is the #1 program that keeps children safe after they've been identified as sex trafficking victims. And I work with young people who are sex trafficking victims, and getting connected with Center for Youth and Safe Harbor can sometimes be the difference between life and death for them. I'm very pleased to support this, and if there's anything I can do in the future to support Monroe County continuing to get funding from the state, I would be more than happy to support that. Thank you.
Thank you.
Thank you, Legislator. Legislator Cayley?
Thank you, Madam Chairman. Through you to the administration. What do you anticipate the county's outreach will be once this funding is gone?
Unfortunately, the state doesn't, through the chair, unfortunately, the state doesn't recognize the importance of that reaching out. Center for Youth is an awesome partner in doing it, and that's what they do well, and that's why we contracted them since 2012 to be our partner for this program. Unfortunately, youth don't think in their mind when they're going through such an awful thing as being trafficked to say, hey, I think I might need to go to 111 Westfall and let someone know that I'm being trafficked. It doesn't work that way. Our advocates at Center for Youth are the ones that go out and find these victims, and that funding comes from New York State, and they know that it comes from there, and the state knows those dollars are being used for that. Unfortunately, they still will be taking that funding away and putting it towards other counties. If a youth does find his or her way to the county and need assistance as a victim of sex trafficking, the template is in place for the county to get that victim the resources and services it needs. The problem is youth just don't come to us. We need to go actively find those youth.
Yes, thank you. I understand. I echo Legislator Connolly's remarks. This is extremely important. And can you, through the chair, can you give me a figure of, with this 92,000, approximately how much Monroe County has received for this program? Total?
I'm sorry, how many, through the chair, how many dollars we've received?
How many dollars throughout the year?
I can get that for you, through the chair.
I'm sorry, I didn't hear that.
We will be able to provide that to you.
Thank you very much. The last question I have, through the chair, have we tracked any instances of, or has data come through Center for Youth of recidivism?
Through the chair, do you mean a victim that has been re-victimized?
Yes.
We can certainly look for that.
I would appreciate that, thank you. I'm hoping not to get any, obviously, through the chair. Thank you.
Any other discussion? Being none, all those in favor, please signify by saying aye. Aye. Any opposed? Item carries. Are there any other matters to come before this committee? There being no matters, the February 28th, 2017 meeting of the Human Services Committee stands adjourned. The next meeting of the Human Services Committee will be held on Tuesday, March 28th, 2017 at 5:30 p.m. Thank you.